Welcome to the Greening Healthcare webinar, Finding the Win-Win-Wins, Managing Hospital Facilities in Challenging Times. My name is Michael Pagel. I'm the Program Manager of Greening Healthcare. And these forums are the program's larger events with the goal to help you reduce energy emissions. We have two parts today, totaling 4 hours, so make sure you're remembering to stretch from time to time. Part one that'll start right now provides the context on sustainability with our senior management group, and then we'll follow with resources available for healthcare. Part two is more technical, includes our initiative of benchmarking of North American hospitals, as well as the topics of ventilation resiliency and implementing the low carbon central plan. And we encourage these webinars to be interactive. So there's two ways that you can communicate with us. Please use the Q&A button for any questions that should be asked to the audience and answered to the audience. And then we'll also have a record to follow up after on those. Use the chat button more for private questions to the hosts or panelists, or if you need any help using the webinar app. This webinar is recorded and will be posted within the next week or so to our Greening Healthcare site, greeninghc.com. And we're pleased to be partnering on this event with CHES, the Canadian Healthcare Engineering Society. And as always, thanks to our sponsors for their support, Enbridge Gas, Thermogenics, and Armstrong. Greening Healthcare is run under the nonprofit organization Climate Challenge Network. And your hosts today are Ian Jarvis, the Executive Director of the Climate Challenge Network, and Amdi Dial, the Technical Director. And we also have a note from one of our industry sponsors, if you go to the next slide in. Thanks again, Armstrong Fluid Technology. Expedite HVAC upgrades to improve ventilation and reduce the risk of infections. To learn how Armstrong can assist you with the following Made in Ontario solutions, visit their site. If you don't have enough time to scribble all that down or take a screenshot, just Google Armstrong and check out the healthcare section. And so I'll turn it over now, Ian, if you want to do the agenda and acknowledgements.
Yeah, thanks, Michael. So, and good morning, everybody. Good to start today it's morning for everybody, and it will change over the coast. We got a significant number of people in from British Columbia and California, and welcome to everybody. We begin with land acknowledgements for these events, and while we're meeting today on a virtual platform, we acknowledge the Indigenous people of all the lands that we're on today, which each of us calls home. From coast to coast to coast, we acknowledge the ancestral and unceded territory of the Inuit, Métis, and First Nations people that share these lands with us. I acknowledge that I'm speaking today from Toronto, from the traditional land of the Huron-Wendat, the Haudenosaunee, the Anishinaabe, and the Mississaugas of the Credit River. Those acknowledgements are significant and important to us and fit well into the conversation that we're conducting today. The morning session, as Michael's mentioned, is we have an extraordinary executive panel today representing jurisdictions across North America that we welcome to provide context for the whole conversation. And then we have a group coming in to talk about, once hopefully everybody's convinced that these areas matter, they're significant, they're urgent, they need addressing right now. We have a resourcing panel, which is our Building Towards the Low Carbon Future session, which looks a bit at lessons learned, at federal support that's available, at some of the emerging issues across North America as different jurisdictions struggling to deal with the realities of climate change and achieving a monumental task of changing the trajectory of the way that North America and the world is working. What I wanted to do was begin with setting the context from the perspective of what we're hearing from Greening Healthcare member hospitals as being the priority for them. And we've been using this visualization, credit to the Hamilton Spectator, over a year ago. They picked up on this idea that we're preoccupied with COVID. There are economic fallout consequences coming out of COVID, which today we see as being significantly more nuanced than the idea of a recession. That's not necessarily going to be the case, but there are certainly big economic implications of what's happening with COVID. But this giant wave, the third wave that's following around climate change that we still haven't come to grips with, and perhaps over the course of the pandemic, we may have lost a couple of important years in terms of progress around that. So we like this visualization. This second wave we see as being a complex mix of infrastructure spending, of green investments, but also budgetary constraints that we think will be felt across North America and across the healthcare sector. So this for us captures the idea it's time to change the channel. While COVID is certainly not yet behind us, climate change is there. It needs to be addressed. It needs to be addressed right now. We, and I know Dr. Ballam's going to be picking up on this in more detail, but wonderful coordination with the United Nations and the IPCC issuing their report last weekend, which wonderfully sets the stage for what we're doing today and provides an excellent and urgent overview of the physical science behind what we're seeing with climate change, which is updating itself and renewing all the time. We refer back to the WHO, the World Health Organization, World Health Report back in 2002. At that time, the death toll annually through extreme weather and through the other consequences of climate change had already surpassed 150,000 deaths annually. That was in 2000. That number is significantly higher now. So there is a mortality attached to this, as well as the environmental and economic aspects. But what is driving us within Greening Healthcare right now is these last two bullets. So just looking at Canada, and we think that there are certainly similar stories in Australia and Europe, and will be emerging in the United States. The fourth biennial report that Canada submitted reported on 2% actual reduction in greenhouse gas emissions over 12 years. So I'm an engineer, so I can do simple math. So that's less than 2%, 0.2% per annum, and that the building share of that was largely unchanged. If you look at the bar charts, that chunk is pretty much hanging in there. From Government of Canada policy standpoint, the Pan-Canadian Framework, which has been guiding all of our activities since 2016, looked for 30% reduction by 2030, which in round numbers is 2%. On July the 12th, Minister Wilkinson upped the ante there to a target of 40 to 45% by 2030. So that's 3 to 4% per annum. So we're talking about an increase of 20 times the progress that we're making right now. And our argument is that within that concept, the building sector is the most accessible, the most available, the most economically advantageous. It involves almost the whole population, and it's the one that we need to press on with. So meeting the targets, then the focus on healthcare looks at healthcare's contribution to the emissions picture, which is disproportionate to the size of the industry for obvious, to the size of the overall economy for obvious reasons. It's a very carbon intensive, energy intensive, product intensive sector. But the healthcare has a particular responsibility in this space, and in particular, the North American healthcare sector, which you can see with around 5% of the world population, is responsible for almost 30% of healthcare related greenhouse gas emissions. So all of this we know, and as we were putting this program together, our focus was entirely on the facility directors in hospitals, in every one of the several hundred hospitals that are represented on this webinar today. So you are our primary audience for this. Our goal is to give you both the context of what you can expect over the next 6 months and the next 2 years and the next 10 years around climate change response, and in the afternoon session to give you a proposed framework for tackling energy efficiency and greenhouse gas emissions reductions in every hospital across North America, and then by extension around the world. So you're our target, you're our goal. We're hoping to continue the conversation after this forum and hear back from you on whether we were successful in giving you some of the tools, the resources, the information you need to move forward. Michael summarized this before. Greening Healthcare has been working in this space for almost 20 years. Over that period of time, it's a data-driven program. We have a massive database with frankly thousands of hospitals. We've been tracking performance over time. We've been tracking improvements over time. We've been looking at different jurisdictions. We've been looking at new hospitals versus old hospitals. And the Greening Healthcare program looks to provide everything hospitals need to plan their path forward with respect to emissions and energy use, and to take action and to be recognized for the successes that they achieve. Greening Healthcare is one program of Climate Challenge Network, which was founded in 2019. It's a large nonprofit corporation with a North American mandate, frankly, to tackle emissions reductions in buildings, in big buildings. Climate Challenge Network doesn't look at residential homes, it doesn't look at industry, it's focused entirely on buildings, and again, that enormous economic and environmental opportunity that exists through improving the energy efficiency of building stocks, commercial, institutional, and multifamily residential buildings. So these are your sponsors. These are the groups that are working to put together, again, the information and resources that will hopefully be helpful for every hospital moving forward down this pathway.